Borderline personality disorder. Mental health is defined as a person's condition with regard to their psychological and emotional well-being. Borderline personality disorder is a mental disorder marked by an ongoing pattern of varying moods, self-image, and behaviour. Some symptoms of BPD include an intense fear of abandonment, even going to extreme measures to avoid real or imagined separation or rejection. A pattern of unstable, intense relationships, such as idealizing someone one moment and then suddenly believing that the person doesn't care or is cruel. A distorted and unstable self-image or sense of self. Impulsive and often dangerous behaviours such as spending sprees, unsafe sex, substance abuse, reckless driving, and binge eating. Suicidal threats or behaviour or self-injury, often in response to fear of separation or rejection. Intense and highly changeable moods with each episode, lasting from a few hours to a few days, as well as inappropriate, intense anger or problems controlling anger. Feelings of dissociation, such as feeling cut off from oneself, seeing oneself from outside of one's body, or feelings of unreality. As with other mental health disorders, the causes of borderline personality disorder aren't fully understood. In addition to environmental factors such as a history of child abuse or neglect, borderline personality disorder may be linked to genetics, as some studies of twins and families suggest that personality disorders may be inherited or strongly associated with other mental health disorders among family members, as well as brain abnormalities. Some research has shown changes in certain areas of the brain involved in emotion regulation, impulsivity, and aggression. In addition, certain brain chemicals that help regulate mood, such as serotonin, may not function properly. Psychotherapy is the first-line treatment for people with borderline personality disorder. A therapist can provide one-on-one treatment between their therapist and patient, or treatment in a group setting. Therapist-led group sessions may help teach people with borderline personality disorder how to interact with others and how to effectively express themselves. Certain medications may help symptoms or co-occurring problems such as depression, impulsiveness, aggression, or anxiety. Medications may include antidepressants, antipsychotics, or mood-stabilizing drugs. To help a friend or relative with the disorder, you can offer emotional support, understanding, patience, and encouragement. Change can be difficult and frightening for people with borderline personality disorder, but it is possible for them to get better over time. You can learn about mental disorders, including borderline personality disorder, so you can understand what the person with the disorder is experiencing. You can encourage your loved one who is in treatment for borderline personality disorder to ask about family therapy. You can also seek counselling for yourself from a therapist. It should not be the same therapist that your loved one with borderline personality disorder is seeing. It is important to learn about mental disorders like BPD in order to destigmatize and spread awareness. It also helps people to better support and understand people in their life who have the mental illness. If you're suffering from borderline personality disorder, there are some things you can do to help cope better. In addition to getting professional treatment, you can help manage and cope with your condition if you learn about the disorder so that you can understand its causes and treatments. Learn to recognize what may trigger angry outbursts or impulsive behavior. Seek professional help and stick to your treatment plan, as well as attend all therapy sessions and take the medication as directed. You can also work with your mental health provider to develop a plan for what to do the next time a crisis occurs. Manage intense emotions by practicing coping skills, such as the use of breathing techniques and mindfulness meditation. You can build a support system of people who understand and respect you. Here are some resources if you are struggling and need to reach out for help.